I call the member for Jagga Jagga.
Thank you, Deputy Speaker. Look, it is a privilege to rise to speak on this motion because it is fundamental to what this government is about and is fundamental to what Labor governments are about. At its heart, it's about how we regard being Australian, that access to quality, universal healthcare, which Labor governments always stand up for. And on that note, it was, I think, disingenuous of the member for Forrest to say that things have, in fact, got worse under this government. What has happened under this government is that we have reversed the freefall in Medicare bulk billing that was happening under those opposite. We have opened Medicare urgent care clinics right around this country. Those opposite did not do that. They did not offer this opportunity for walk-in bulk billed care in our communities. In fact, in my community, Deputy Speaker, we now have 2 Medicare urgent care clinics. Just recently, over summer, a new clinic opened in Eltham, providing fully bulk billed treatment for non-life-threatening illnesses and injuries without the long waits that people too often face in emergency departments. That joins the one that we had existing in Heidelberg on Burgundy Street, which has supported thousands of locals since it opened in 2022. I see this firsthand in my community. Parents of young children who otherwise know that they were in for a long wait at an emergency department after perhaps an injury at a sporting event, elderly people who do feel like they just need to be seen and can't get into their regular GP at that time. This clinic is providing all of those people and others with support and care that they never had before. And it is providing it because this Albanese Labor government believes in Medicare, because we are funding Medicare in our communities. One local, Rihanna, shared her experience with me, saying that she went to the clinic when her daughter was in severe pain. She described the staff there as welcoming and compassionate. The doctor is knowledgeable and said the care helped to ease her daughter's pain. And for her, the relief was finding the clinic and not having to wait as long and having that peace of mind almost immediately. And Deputy Speaker, on that note, I want to acknowledge the incredible doctors and nurses who do keep these clinics running, who are part of our Medicare system. Again, I've had wonderful feedback about the people who work in these clinics. At the Eltham Clinic, Shireen shared that after finding all the GP appointments fully booked, she was feeling overwhelmed and on the verge of tears. So she was able then to meet with a staff member there, Alison, who took the time to listen, who treated her with care and understanding and went out of her way to help. And it's that approach that means people are getting both empathy and the care that they need. And again, it's a testament to the value that we put on Medicare. Outside of Medicare clinics, we are also delivering cheaper medicines for people in our community. We have reduced the maximum cost of PBS prescriptions to $25 and $7.70 for concession card holders. In Jagga Jagga, locals have now saved more than $15.4 million from 1.7 million cheaper prescriptions. This is real cost of living relief, and it means that people are able to access these prescriptions without worrying about what trade-offs they're making in their lives. We do not want to see people going without the medicines they should have, the medicines they need to have, because they are needing to make choices about what they pay for. That is, again, a fundamental tenet of this government. It is what we believe in, that access to these medications, to this healthcare, should be for all Australians, not just for some Australians. We've introduced 1800 Medicare, where locals can now access free 24/7 health advice from registered nurses. So whether you need expert guidance, simple reassurance, the nurses at 1800 Medicare are available around the clock, and they can refer you to the right care, whether that is back to your regular GP, a local hospital or a Medicare urgent care clinic. We've made major changes to bulk billing, tripling the incentives for GPs to bulk bill. And again, I get a lot of feedback about this in our community. I'm pleased to see that the Greensborough Medical and Dental Clinic on Flintoff Street is now 100% bulk billed for GP visits. I know other clinics in my community are following suit. And again, this is making a real difference to people's lives. But these are the investments that only happen under Labor governments. Under those opposite, bulk billing was in freefall. We did not have walk-in Medicare urgent care clinics. We did not have the discounts that we've made on PBS scripts, because those opposite do not understand that part of being Australian is access to good quality healthcare.